Hi everyone. Nowadays, many people are concerning about the pain just closer to the scapula bone. That pain is actually a nagging type of pain, which is not so comfortable. It will be so disturbing while we are sleeping, while we are moving, while we are walking, even while we are sitting also. So people complain that that kind of pain is highly irritating. So highly so it's like aching type of pain, nagging type of pain. So they are not able to tolerate it. Actually, what is happening? Why this pain occurs? You want to see basic things. We have a muscle called rhomboiditis here. Rhomboiditis have one brother and sister. One small sister that is called rhomboiditis minor. One big brother that is called rhomboiditis major. Rhomboiditis minor actually starts from the spinous process of the C7 and crosses until and lies until T1, and that is going to reach up to the middle border of the scapula, just closer to the pitch of the spinous process of the scapula. And we have, I mean just below that we have rhomboiditis major, that is going to continue from the T2 to T5 at the spinous process, and then it is going to attach to the middle border of the inner portion of the middle border of the scapula. These two muscles are attached like this subsequently, right? When these muscles are getting compressed, or when these muscles are going for spasm, it causes a nagging pain around the middle border of the scapula. How it is actually occurring, this muscle is very important even in all the activities. How this is occurring? When you are sleeping at the night time, when you are sleeping, especially at this side, the scapula moves like this, and the spine will be resting here. The scapula will be compressed between the bed and the body weight. So the scapula moves like this. So the rhomboiditis major and minor will be in this shortened position. In that position, when the particular muscle is being in a continuously being in the position for a prolonged period of time, it causes tender points or trigger points or spasm creates, which may induce pain after when you are getting up from the bed, actually in the morning. So what it is doing? Logically, this muscle is actually active while you are walking, as well as it is an important muscle, because while you are trying to walk, you are going to swing your arms. During your swing phase of the arms, this muscle is so active here. So the people will say, when you try to walk, the muscle is paining. But they don't know, because of the swinging. They will complain, even when I am trying to walk also, the muscle is paining. They will say. Some people will say, even if I am trying to take a deep breath, that pain is occurring. That nagging pain is occurring. Because when they try to have a deep inspiration, this muscle is actually going for, the thoracic is going for expansion, and this muscle is going for little bit stretch. And the shortened muscle is going for stretch, that triggers the spasm. So that creates pain. And when you are trying to attempt an abduction to the side, that muscle is very important muscle. That muscle should actually hold your scapula in the position so that you can move the hand easily. If your rhomboiditis major and minor is not working properly, you cannot be able to lift your arm. Especially to the abduction, you cannot do. This muscle has to stabilize along with that. This rhomboiditis major and minor, along with serratus posterior plus infraspinatus and supraspinatus plus subscapularis, all these muscles put together will try to stabilize the shoulder joint for the further movements. So if this muscle is affected, the stability of the scapula is affected. When the stability of the scapula is affected, ultimately the stability of the shoulder is affected. So what shall we do for this? So typically people will say, what you will do when you are having the pain? What you will do? When I ask to the patient, they will say, whenever I feel, frequently I used to use my opposite hand to reach over this area and try to rub over this area, or else they try to bring it to the top, reach over this area, and they try to fix it with a finger or thumb or something. They try to rub it hardly. This becomes the mannerism for those kind of patients when they are having nagging pain. Even with this simple clue itself, we can identify that patient is definitely having this rhomboiditis. But the point is, the same rhomboiditis pain may be hidden by the symptoms. Rather than this, it is hidden by the symptoms by the middle and upper trapezius, levator scapulae, subscapular pain plus serratus posterior pain. Okay? All these pain may cloud on this and try to compensate this. So we cannot actually differentiate whether this pain is happening because of rhomboiditis major or minor or these kind of things. Okay, but the people will say exclusively that they are having pain when they are operating the arm. They will have pain over here near the spine. One. Second thing, they will say while they are walking, especially during the swinging phase, they will have pain over this area. These two are important clue for this rhomboiditis type of pain. Okay.